Words to you: shin splints, plantar fasciitis, Achilles tendonitis. Hi everyone, I'm Dr. Heather, your virtual sports chiropractor. And if you haven't heard just yet, I've created 27 tips and tricks for runners on injury prevention. Over the course of the next 27 weeks, we're going to talk about each one of these tips right here on the channel. But if you want to grab the complete guide, go ahead and click the link down below. Now again, these tips are in no specific order, but we're going to get started with tip number 21, which is look at your prior injuries. So if I grabbed your attention right off the bat by saying 3 different common injuries that I see in runners. I see it all the time on social media sites. People saying, hey, I think I have this type of injury, but I'm going to keep running, or what should I do about it? Well, first thing we want to do is really look at your injury history. So we want to really start to understand what types of injuries have you had, and really figuring out, okay, well, what created this latest injury and how do we go ahead in preventing it from reoccurring, or how do we go ahead and really healing that injury quickly so you can get back to running. So by understanding, how old injuries kind of affect our current injuries or can help or can lead to a new injury, this is something that is really, really important to understand. It's interesting. I think every single person I've worked with, especially some of my females, I will actually ask them, especially if I know that they've had children, if they've ever had any specific types of injuries like low back pain, sciatica, if they've had IT band issues before, to really get a better understanding of biomechanics, and also too, what other pain symptoms might be going on. But also, if we can understand that history list, if we know that they've had a host of different injuries and maybe those injuries haven't fully resolved themselves, they've only gotten maybe 60-70% better, and then they go ahead and they start doing an activity like running, there's a chance of another injury setting in. There's a chance of injuring that old injury or irritating that old injury because we haven't really fully addressed it. And a lot of times what we're going to notice is that those old injuries do go ahead and change our gait when running. Meaning, like, if we are somebody who suffers with shin splints and we try to really push through the shin splints and we try to really get back to running a lot faster, chances are we're going to automatically, our subconscious is going to start changing the way we run, which could then lead to a knee injury setting in or tight IT bands, and vice versa. So we could actually notice that our hips tighten up, and then we say, no, we're going to try to push through it, but then we notice that we're striking the ground a little differently with our foot, and then what happens is like a plantar fasciitis issue sets in. So really having an understanding of our prior injuries, what's been going on, and really having a professional kind of look at that timeline to really kind of dissect where you need to go is going to be really key in helping you with injury prevention. Now, again, if you want to go ahead and have a private consult with me to get a little bit more insight in regards to some old injuries, if you're not sure if they're going to flare up as you currently start your training for this year's running event, go ahead and drop some comments down below. I'm happy to set up a time with anyone who watches this video, and there's no obligation at the end. And again, guys, like I said, you can catch all 27 tips right here on the channel. I'm Dr. Heather, your virtual sports chiropractor, and I'll catch you in the next video.